This system is doomed, doctors, nurses sound off in NBC News coronavirus survey. More than 250 healthcare workers responded to a social media survey seeking first-person accounts from those on the front lines of the coronavirus pandemic. A hospital nurse in Michigan says she and her colleagues have discussed bringing in bleach to make their own disinfectant wipes. A pregnant nurse in Ohio says she has no choice but to tend to critically ill patients without a specialized N95 mask. And a healthcare worker in Georgia has resorted to scouring local hardware stores in an effort to secure the protective masks. These are just some of the stories told to NBC News by more than 250 healthcare providers on the front lines of the coronavirus pandemic, including many who work in major hospitals. The accounts were solicited through an NBC News survey, pushed out on social media, about access to personal protective equipment, PPE, a broad term for the gear, such as masks, glasses, gowns and respirators, donned by healthcare workers to protect against the transmission of germs. Nearly all who responded said there were shortages of PPE in the hospitals, outpatient clinics, and offices where they worked. Many reported being forced to ration or reuse supplies, including surgical and N95 masks, for fear of running out. Many also said they were facing shortages of basic sanitary supplies, including hand sanitizer and disinfectant wipes. NBC News was not able to independently verify each account. But where possible, the facilities were contacted and given an opportunity to respond. The nurse in Michigan, who is based in Flint and works primarily with immunocompromised patients, said that nurses at her hospital have been rationed one N95 mask each and are being required to store them in a bag and reuse them, against manufacturer guidelines. Nurses on her floor, she added, have also been unable to obtain enough disinfectant wipes. We ordered 5 containers the other day and we only got 1, she said. Like many medical professionals who spoke to NBC News, she asked to remain anonymous for fear of losing her job. 1 container of bleach wipes for 42 beds. I don't feel like my hospital is failing us, she said. It's the whole system that's failing us. We certainly would not ask a firefighter to fight a fire with a spray gun, said Deborah Berger, president of National Nurses United, the nation's largest nurses union. Berger, who has been a registered nurse for 45 years, said that neither the government nor the private sector are acting fast enough to get critical supplies to those who need them. It is a moral obligation of our government and our employer to provide safety equipment to those of us on the front line, she said. We are unable to protect ourselves. The overwhelming majority of the medical professionals across the country who responded to the NBC News survey expressed concerns about a lack of N95 masks, which offer more protection than surgical masks. A healthcare worker at a hospital in Indiana described a Kafkaesque scenario. Medical staffers can only get the masks when a patient has tested positive for the virus, but the facility has no way to confirm a case. There are many possible exposures in my hospital but are not equipped with the testing devices in order to confirm the cases, the worker wrote. We are then not allowed to wear proper PPE because they are not positive and because our hospital is short on the PPE. We are also told that we are expected to keep the N95 masks for several days and several patients and that they can be disinfected with Sanicloth wipes. We do not have N95 masks, so we are being asked to intubate patients, which exposes us to entire airway, with normal masks, wrote the pregnant nurse from Ohio. It is unacceptable. We are supposed to treat every patient as suspected positive but we are unable to protect ourselves. The N95 mask filters out airborne particulates and aerosols, and the Food and Drug Administration advises that neither N95 masks nor surgical masks should be used more than once. But in response to growing shortages of PPE, the Centers for Disease Control and Prevention has loosened its guidelines on proper use and reuse of masks. On Thursday, the agency advised that bandanas and scarves could be used by healthcare workers in place of a mask as a last resort. A nurse in Illinois shared a photo of her N95 mask she keeps in a bag labeled with her name. Many healthcare workers are being asked to ration their personal protective equipment. A nurse in Illinois shared a photo of her N95 mask she keeps in a bag labeled with her name. Many healthcare workers are being asked to ration their personal protective equipment. Via social media. The fact that a recommendation like that came out from the Centers for Disease Control is mind-boggling to me, said Dr. Adam Friedlander, an emergency physician working in Atlanta. There was a time when a recommendation came from the CDC, we knew that it was evidence-based guidelines for how we could protect ourselves from becoming sick with a potentially fatal illness. Now we know the recommendations are coming from a place of desperation, acknowledging that these supplies are unavailable. A nurse who works at a major hospital in Massachusetts and spoke to NBC News on the condition of anonymity, said that medical staff have been told they must reuse their N95 masks 5 times before they are able to get a new one. It's scary to have to reuse the mask, she said. At the same time it's like, what are you supposed to do if there's none to be had? A nationwide problem. The U.S. Department of Health and Human Services said in a statement this week that the agency has been steadily deploying PPE to areas in need from the Strategic National Stockpile, the nation's supply of pharmaceutical and medical supplies, intended for use during a severe public health emergency. We have been transparent that more supplies are needed, hence the request to Congress for additional funding so we could procure more and scale up production, the statement said. The role of the SNS is to fill the gap temporarily until states and localities working with the private sector can respond to the state and local needs.